Now for today's program. Muso was founded more than a decade ago by a small group of Malians and Americans who came together to address the injustices of health and poverty they witnessed around them. Dr. Jessica Beckerman is Chief Medical Officer and co-founder of Muso, where she oversees quality and integrated care delivery from community to clinic to hospital. She also works clinically as an obstetrician at Highland Hospital, a public safety net hospital and large teaching hospital in Oakland, California. A graduate of Brown University, Jessica has worked in Mali since 2004, where she was a Fulbright scholar. Prior to co-founding Muso, she worked at Partners in Health and for the African-based organization Tostan. Dr. Ari Johnson, a global expert in community health systems design, is co-founder and CEO of Muso, as well as associate professor at the University of California, San Francisco Global Health Sciences. A graduate of Harvard Medical School, Ari has conducted research at many institutions, including the National Institutes of Health, the Medical Research Council of South Africa, and the Kuvan Center for the Study of Infectious and Tropical Diseases in Jerusalem. Ari has published peer-reviewed articles and essays in the fields of infectious disease, health systems design, socioeconomic determinants of health, AIDS, and migration. For their trailblazing work, Ari and Jessica were awarded this year's Charles Broffman Prize. The Charles Broffman Prize recognizes young humanitarians whose work is grounded in their Jewish values and is of universal benefit to all. George E. Johnson is a Washington-based lawyer and writer. Since 2013, George has been a senior editor of Moment magazine. In addition to his columns, interviews, and featured articles, Moment has published both his symposium-based ebook, What Will the Jewish World Look Like in 2050, and an excerpt from his Vietnam memoir, When One's Duty and the Right Thing Are Not the Same. George's articles on Jewish life have also appeared in many other publications, like the Journal of Jewish Ideas and Ideals. He has also served as research director of the Institute for Jewish Policy, Planning, and Research of the Synagogue Council of America. George is also the proud father and father-in-law of Ari and Jessica. Please welcome Jessica Beckerman, Ari Johnson, and George E. Johnson.
It's a pleasure to be here, a threefold pleasure to be able to talk with my son and daughter-in-law, who I don't always get a chance because they're so busy. Secondly, to talk about Muso, which is my favorite topic. And third, to be able to share the story of Muso with the audience here today, the Moment audience. So it's a real big pleasure. Ari,
pleasure to be here with you, George.
Ari and Jess's organization was founded by them 16 years ago and has grown from an idea in their heads to an international NGO. Muso today employs a diverse group of medical and health professionals, high-tech and academic research folks, and hundreds of health workers, helping to improve the lives of hundreds of thousands of people in West Africa. Before we start our conversation about how all that happened, I think the audience today might like to know a little bit more about what Muso is today, what it's doing, how and with whom, and some of the things it's accomplished. To help us with that, Ari and Jess have provided a very short video that will give a flavor of what Muso is about, which we will show you now.
Muso hala yini te dore bana fen be na bi se ka kishi ama ani ami se ka furake olu kana se ka ke mokoshi satai furake ni jona nafa fene ka bonde ka bana ko la kosebe Banije Muso yare sigida kene asin dogo sigi dugu kono munu be yala kan denw kɔlɔsi sanga ni waati ka lajɛ ni bana b'u la.
Si je trouve l'enfant malade, je vais soigner à la maison s'il n'y a pas de signe danger. je vais traiter avec les médicaments à la maison.
Je suis rentrée dans ma zone aujourd'hui. Je suis venue trouver des enfants malades qui sont à la maison et voir leur température. Ensuite, je les ai fait le TDR d'abord.
Et puis, pendant 3 jours, je vais aller chez eux pour regarder si l'enfant est guéri. Pendant 3 jours, si moi j'ai vu le signe de danger, je vais amener à la SESCOM.
Muso ye furakɛli sɔngɔ bin ka bɔ a ka farigantɔw kan. A y'a ka personnel formé n'o y'a baarakɛɲɔgɔnw ye walasa furakɛli yɔrɔ la an bɛ se ka damu sɔrɔ furakɛli ɲuman ka kɛ ani banabaatɔw ka se ka lafiya. Bana tɛ digu la kuma tɛ k'u faga o kɛlen saya nana kɛ fɛn ye min dɔgɔyara an ka sigida la kosɛbɛ.
Thank you. Thank you. Ari and Jess, it's 16 years since you founded Muso. You had just graduated or about to graduate from college. Where did the idea of Muso come from? How did it start?
Well, I can share what pulled me into the work, one moment from that journey. I remember some 16 years ago, I was in Providence, Rhode Island, and I was in my apartment. I was reading a book by one of my mentors, Paul Farmer, and it was reading about inequity in access to care, about how every year millions of people are dying because of curable illnesses, because they aren't accessing the healthcare they need in time. We're talking about the equivalent of the entire populations of Manhattan and Chicago and Houston killed every year from preventable and curable diseases because they're not getting access to care. And I was reading about this and I stood up, the sun was setting, I stood up to daven mincha, to pray the afternoon service. And as I was praying, just the weight of that, the magnitude of that injustice, that suffering kind of hit me. And I recognized something I hadn't recognized before. You know, I thought of tshuva, the Jewish concept of repentance, forgiveness in my life, as being about seeking forgiveness for the bad things that I'd done in my life. And I realized that the real tshuva that I needed to seek was not for what I had done wrong, but was not for the sins committed, but my sins of omission, what I had the power to do, but then failed to do when I had failed to take action. And as that hit me, I was just, that really, you know, I was davening mincha and crying and thinking about this, that lit a fire under me that eventually connected me through common mentors to this amazing group of Malians and Americans, including Jessica, who co-founded Muso.
And around the same time, or slightly before Ari had this moment, I had been working in Mali as part of the lab at the University of Bamako on a public health research project. And through that work had met some incredibly visionary young Malian physicians and medical students who were really pulling out all the stops to help their patients to access care, despite the incredible complexity and challenges of the system that made that often near impossible. And through that work with them and several of my friends from Providence, including Ari, we all decided that we were going to try to create a different kind of option for people, and that we had gotten to know as we moved into this community on the outskirts of Wamata together. And it was there where we were really welcomed into this community, like in the shadows of the capital city, by Nana Nyare, who is essentially this matriarch of this community. She really adopted us, and not only as like visiting students or visiting researchers, but like as her family, as her own children. And we were living with Nana, and we were living in this area I ended up, after I finished college, came back on a Fulbright scholarship for a year and a half, and Ari ended up taking a year off from medical school to come and be there with me. And we really got to know our neighbors, and our neighbors, confronted with the challenges of the healthcare system, started coming to Nana, and through Nana coming to us when they were in crisis. And so we would wake up every morning to our neighbors and our friends at our front door in our courtyard, with just like one catastrophe after another, these preventable conditions. One of our friends had an 8-year-old son who fell into a coma and didn't access care in time for his AIDS and his meningitis, and showed up at the brink of death. And we did what anybody would have done, which was to try to rush him to the health facility, the nearest health facility, and support him and his mother and his family to navigate the healthcare system. And for this child, it was too late. And sitting at his funeral, we started to ask ourselves, why did this happen? How could this possibly have happened? He had preventable and treatable disease, and we're in the 21st century where we have had now for almost a century most of the tools that we would need to antibiotics, most of the interventions that we would need to cure most of the illnesses that we were seeing day to day. It's like, how could this possibly have happened? And it kept happening. And we found ourselves, Ari and me and our Malian colleagues, we found ourselves at funerals over and over again, just mourning with our neighbors, and over the deaths of children and over the deaths of often women my age, who had complications related to pregnancy and childbearing. And so this really lit a fire under us. And the core theme that we saw was that people were dying because they were not accessing healthcare in time. They were not getting access to these basic tools that I always took for granted growing up in the United States had access to, that the world has access to. And people were not getting access to them in a timely fashion. And so working together, Muso really came into existence through those very early and frequent encounters with our neighbors, with patients who were struggling against all odds to access care. And we committed together to try to make care available in a timely fashion so that people would not be dying from delays in access to healthcare.
So how did you decide what to do? What did you do?
So the first and most important thing we did and our Malian co-founders did was to listen. We spent a lot of time listening to our friends, our neighbors, our patients, and considering them as our teachers, as our professors on the journey, because who knows better about these injustices than those who face them most directly. We had our friends, our neighbors, our patients tell us their whole life stories from the moment they were born to the moment they or their child needed care, and walk us through in great detail every step along the way. And they showed us that, some of the conceptions would come in with, both of us doing medical training, we had the sense of, tackling illness, these problems disease by disease. There's a lot of malaria, so maybe we had a malaria problem, right? And maybe we should create a malaria program. But in fact, our patients, our friends explained to us that they didn't really have a malaria problem or a pneumonia problem. They were facing a problem of delay, of not accessing the care they needed and deserved in time, because they didn't have the money to pay for the fees or the medications. They couldn't pay for the co-pays or the deductibles. They couldn't get off work, because if they didn't work one day, they wouldn't eat, and their family, their kids wouldn't eat the next day. They couldn't find childcare. They're facing these financial barriers, these geographic barriers to getting the care they need for themselves and their kids. So our patients basically gave us a roadmap and said, these are the barriers that matter. This is the problem that matters. And out of that, we were able to build with our partners a different kind of health system that, instead of sitting and waiting, as I was trained to do, these great institutions where I trained at, sitting and waiting for patients to come to me, instead of doing that, sending health workers out, as you saw in the video, every day to conduct millions of house calls, searching for patients who need care, bringing care into the home, 90% of patient care happening in the home, and then evacuating very rapidly the sickest patients into redesigned, upgraded clinics.
Who did all these things, Ari? Explain, if you would, who was doing all these things and how did you get them to do them?
Well, we didn't really get anyone to do anything in a sense, because this is all a big partnership. From the beginning, this amazing co-founding group of Malians and Americans, and we had the opportunity to be a part of that, right? And then we also, from the start, created a partnership with the Malian government. The government of Mali, we now have a partnership also with the government of Cote d'Ivoire. These two governments are together responsible for the health of their 46 million combined citizens. These two governments have asked our team to partner with them to test new approaches that could be integrated into national healthcare reform, national policy, to serve all their people. And so from the very beginning, this work is all happening through the public sector, through government clinics, and through the Muso team, 90+% West African team, supporting this work and supporting our government partners.
So what were the kinds of people that you were working with? Who were your partners? If you could be a little bit more specific about who it was that you were working with and what were their functions.
Sure. Well, when we first started off, we were literally working out of a converted storage closet with a handful of medical students and young physicians, all as volunteers, or, eventually then we started paying ourselves like $40 a month. And things snowballed and grew as we became more learned, and as we started to find some impact, we were able to grow the organization. And now we have this very skilled international team that includes people with expertise in healthcare financing, people with expertise in technological innovations that have helped all of our community health workers to transition onto smartphone-based technology for their data management, patient documentation. It includes the nurses and midwives and physicians that we partner with at government clinics. It includes training experts, research and monitoring evaluation people, human resources experts. Really, it takes a village to build a health system, and you need people with all sorts of expertise. In the government sector, we've worked with everybody and their best friend from the ministries of health, the minister themselves, to the clinicians throughout the public sector, at the community level, the district level, the regional level, and also a lot of the technocrats that have expertise in malnutrition and tuberculosis and all the different areas that we have together try to improve access to care around. Does that answer your question, George?
I remember Ari sitting around the house writing the curriculum for the first group of community health workers in French. And I said, you know French well enough to write a curriculum? This is a big book. And there he was doing it. And I remember how proud you were when your first class of 20 community health workers graduated. And now you have, what, 400? And so it just didn't happen overnight. There was a long process. And I was wondering, when you look at that process, what were the key points? What were the key steps in getting to where, from that first class of community health workers that you trained to where you are now? You know, what were some of the, was there a point where you thought, you know, this is not going to work, you know, this is going to go down? And what made it not go down? What were some of the inflection points?
Yeah, there were many rough times along the way. It has not been an easy journey. And it began very much, you know, out of the converted storage closet with care for one patient, right? And this year we provided care for our 10 millionth patient visit. And to make it to that point, I think one of the key inflection points, one of the key moments that allowed this work to really start growing, we have so much more work growing to do, but what allowed it to start growing was the fact that with our community partners, we embedded research from the very beginning, and said, we need to do research to hold ourselves accountable, to figure and to learn and to figure out what works and what doesn't. And so we built in a research study with this first rollout of this new proactive speed-based approach to healthcare, right? And that study, that research study, which we published first in 2013 and then a follow-up study in 2018, documented results that kind of knocked all of us out of our chairs. The results that we saw in the video before, this 10x sea change in access to care, and this plummeting of child death rates. These first communities, these areas that we've been serving for the past decade have achieved rates of child survival lower than that of any country in Sub-Saharan Africa for 5 years running, and almost on par with that of the United States. And so those results lit up really a different kind of possibility to say, hey, the death of a child can be rare everywhere, and it should be. The death of a child shouldn't be common in any community anywhere. And if this is possible in Mali, facing some of the hardest conditions, some of the worst injustices in the world, it is possible and it is imperative everywhere. And with that, that was able to, through that, we were able to rally a lot of energy and to grow the work.
Because it's kind of like, oh, sorry, no, I was just going to say, you know, if we can achieve rates of child survival that are on par with that of the United States, we're all kind of out of excuses, you know, like there's no, like those results should not be extraordinary. That should be, like Ari said, that should be the story of our world. And to be standing today in front of this incredible crisis of preventable child death happening, and to be able to see in front of our eyes that another option is possible, and that it can happen in such a short period of time, really gave us the sense of imperative that we had to grow that work and we had to figure out how to scale it. And I think was also very motivating for our government partners that published that research in coordination with us. They were co-authors on the research as well. And so feeling that sense of ownership at all of the levels of the system, from community up to the Minister of Health. Himself really helped Mali also take some big steps around national healthcare reform, which was a critical juncture for us because we, as an organization, began working not only in direct implementation, direct service work, not only in the operational research work that had gotten us to that point, 2011, but also in providing now technical assistance to government partners as they became the owner and the implementer beyond our own direct research sites. And that's really a core piece of our strategy and our model now moving forward.
I remember your first main article was published, in which you published your results about the drop in child mortality, and the articles in, of course, there was the peer-reviewed article in PLOS ONE, I think it was called. But then there were New York Times articles. There was an article in Atlantic. Was that a key turning point? I mean, you've done a lot to kind of bring a lot of different kinds of people together here, government people, and that's really, in Mali, that's a real moving target. And you scaled up the number of people involved, but you've also scaled, this all has required a lot of money. How did you combine your scaling up with this very fluid government that you were working with and all the, you call them distractions, but there were coups and terrorist incidents, and all kinds of things. How did you what was your plan, or what was your method in corralling all these elements? You have now many large foundations and governments supporting your work, and that didn't happen easily. How did you scale it up, and what was the magic sauce here?
Well, first of all, it has at times felt like a lot of money to raise, but it really isn't. The amount of money that it takes to make this kind of transformation is shamefully small. It is, when I say shameful, it causes me hurt and shame to think of how little it takes. That for what many of us spend on like ice cream and coffee in a month is what it takes to have this transformative impact. Say, transforming or saving a person's life with healthcare for a year, right? The abundance of our world makes it imminently possible to do what we're doing with 375,000 people today, and make that possible for everyone in the world. That's imminently possible. It doesn't cost very much at all. It is so within our grasp. It would be easier. I think perhaps it would be emotionally and mentally easier for us to say, no, this is so expensive. This is going to be, an impossible task to mobilize the resources. But it's actually imminently within our reach. We each have this immense power, far more than I think we often realize, to make change, to create healing in the world, to save a life. Each of us has this power within us. That's what we've learned on this pathway.
Was that the secret sauce, was that this is all really very doable, and that it isn't that expensive when you think about it? Is that what sold people on it?
I think impact is what has been motivating for people too. I think, we all of us feel disgruntled when we feel like we're just throwing money at an impossible problem. And when you see that actually it's imminently possible and solvable, and is in fact has been solved for some number of people, it's motivating. Spiritually, it's motivating to do whatever we can to grow that. I think, we were talking about like $10 or $20 per person per year, in addition to investments already existing in the health system in places like Mali, in order to add on this level of proactivity, rapid care, complex quality care available for more advanced disease, $10 or $20 per person per year. And that, when I say that in this kind of context, it just feels like so ridiculous that we would ever be having a conversation about whether that is a sustainable amount of money. But I can't tell you how many conversations we have had about whether that's sustainable, whether the world can afford that. And I think that it also forces us to look at how we value human life, and like whose lives do we value, and how do we truly bring justice in the world and equity and access into the world. And part of that means confronting global systems of racism and discrimination against where people were born, and so many other forms of discrimination. And it's sort of how we truly can achieve justice in the world. And yeah.
I think it was Nelson Mandela who said that it always seems impossible until it is done. That recalls to me a story of when the director of one of the first clinics that Muso worked with, which is now a national center of excellence, place achieving the highest rates of COVID vaccination in the country, for example. Officials from the Minister of Health came to this center to see Dr. Cisse, and they saw this sea change in access to care that was happening. And they said, Dr. Cisse, do you think this is really possible for us to do? And Dr. Cisse looked at them and said, possible isn't the question anymore. Look around you. It's done. Now the question is, are we going to have the courage to do this for everyone who deserves?
And one thing that impressed me, I'm your father, but so I impress easy maybe, was when you got the World Bank to write your guidebook on how to do this or to edit it. And so apparently this message has some legs to it, and you're describing, but it still is, it's hard to imagine in the world that's as unstable as the one that you're working in, that this actually got traction. Is there anything else you would attribute that to?
Civil servants are incredible and underestimated. Mali recently went through a coup d'etat, and the president had to resign at gunpoint. And you look at that from the outside, you read Reuters and CNN, and you have a tendency to just kind of put up your hands in despair and say, what can be done, right? The world is just going down the drain. And let me tell you, within 12 hours of that moment, the next morning at 8 a.m., our chief civil servant in the cabinet of the Minister of Health calls up one of our team members, our lead technical assistant, who's embedded within his team, helping with national healthcare reform. And he says to her, okay, I'm at the office this morning. We've got a lot of work to do. So we're still working, but I think you should work from home today. So the president had just resigned at gunpoint. You'd expect everything to be in disarray, but you've got the vast majority of these incredibly devoted civil servants saying, no, this is my country. These are my people who deserve healthcare, and we've got a job to do. And no extremists, and no one with a specific agenda is going to take that away from us. And so just being able to be there as devoted partners, you get to witness that. We've built close partnerships with civil servants at the local, district, regional, and national level. They call the health system in Mali a pyramid. And if you build partnerships through the whole pyramid, you can build something that's nearly indestructible.
So let's switch gears a little bit You talked a little bit about the relationship between your work and Jewish values. Maybe you can talk a little bit more about that. I think that's really worth pursuing. And also how Judaism played into your work and your relationships. How did the religious element enter into your day-to-day and maybe more than day-to-day relations with the people you were working with? What role did your religion, I mean, your role is not your role, but you're being American Jews, for example, and you're being Jewish. So there are two questions there. One is, what is the relationship, as you see it, between your work and your Jewishness and your Jewish values? And how were you seen by the people you work with? And what kind of people are they in terms of religion?
That's a great question, George. I think we were talking about this a little bit a few minutes ago, related to like why and how this work feels like an imperative to us. We talk about tzedek or tzedakah as like this, like a charity or good deeds, or this like benevolent act that we do because we have the privilege to do. But tzedek is actually translates more to justice. Tzedek tirdof, it's like justice, pursue it, right? Like it's an imperative, you must pursue it. And so that you can live, right? Because who are we? How can we live? Should we not be immersed in the pursuit and this imperative call to pursuing justice? And I think, when you are standing in front of somebody who is suffering or struggling, and you have the tools at your disposal to fix that in some way, you can't stay alive and pursue life, without responding to that and pursuing justice related to that and trying to assuage somebody's suffering when you have the tools to do it, right? I mean, I think it's a human response. It's a Jewish way. It's a way to practice Judaism, is to pursue justice in all the ways that we can. And it certainly is easier when we approach ourselves to the realities that many people are facing in the world that have been impoverished or have been the victims of oppression. And when we are disconnected and we don't allow ourselves to actually see it and connect with that diversity of experience, it's easier to not see it and to not feel like that's part of our daily tshuva. But I think when we open ourselves up to that form of connecting and just being aware of the world, there is this sense of, this is my tshuva, this is what I must do so that I can live too.
It's essential. It's about, for me, when we think about, this is about a question of a core human question, which is, how do we care for each other as humans? What's our devotion to each other as humans in a society? In secular society, we have very few positive commitments, obligations that we make to each other beyond paying our taxes, say. But Jewish law and Jewish practice, halacha, has a radically different vision of the positive obligations, the commitments we need to make to each other. According to Vayikra, Leviticus, it's actually a positive commandment on the same level without thou shalt not kill. It's also a mitzvah that if we have the power to save a life, we have to act. And that imperative is so important, it supersedes even the mitzvot of Shabbat. So we are culpable by our actions and by our inaction. And that, for me, and I think for us, has been a radical orientation of what it means for us to practice as Jews and why this work is so core to our own practice as Jews. We love to cite the Talmud and the Talmudic wisdom that saving a single life is like saving an entire world. And I didn't know until recently where that came from. I was reading about it, and apparently it comes from the story of Cain and Abel in Bereshit in Genesis, where
Say that again. I didn't quite catch that.
It comes from the story of Cain and Abel in Genesis, where God, one of the most evocative lines of God says, "Kol demei achicha tzokim alai min ha'adamah." The voice of your brother's blood is crying out to me from the earth. And the rabbis pick up on a weird grammatical aberrancy, apparently, in that verse, that it's demei achicha, your brother's bloods. Why would blood be pluralized there? And they read it as from the divine perspective, from the perspective of God, the creator of all humans, from an eternal perspective. It was not just the murder of one person. It wasn't just one person's death. It was everyone who came before him, all the generations that he held inside of him previously, and everyone who had come out of from him. And I feel that looking at my son Gavi, and I see in Gavi, I don't know how much he looks like Jess or me, but he has the red hair that you had when you were a kid, and he's
Never know it.
He's stubborn and tenacious, like Saba Shalom, and he has, I see it. He has all of his ancestors living within him, and any generation to come also alive within him. He has the whole world within him, right? So there is this imperative, this moral, emotional, spiritual imperative that we get to through our practice in Judaism that connects us to the immeasurable value of a single human life and drives us to this imperative, a different kind of devotion to each other.
So let's switch gears to the second question, which is you're dealing with a lot of other people, not Jewish. Almost, I think you were just about the only Jews in Mali most of the time you were there. I know you talked about a few aid workers who worked in Bamako and so on, maybe somebody in the embassy, but you were dealing with mainly Muslims and Christians. And your role, how visible was it that you were Jews, and how did that interreligious, well, first of all, it seemed to me from your descriptions that religion plays a really prominent role in Malian society, whatever religion people have, whether it's Christian or Muslim. And you are different, yet somehow or other, it seems to, I don't know if it worked to your advantage, but it did seem to work. And I was wondering if you would talk a little bit about the difference in religion between you and everybody else.
Sure. I mean, I think honestly, George, it's easier to talk about the similarities than the differences. I mean, Mali is an incredibly ecumenical place. People bless each other, dozens, sometimes hundreds of times a day. We get blessings for everything. You walk to the market and you buy tomatoes, and someone's going to say, not just enjoy your tomatoes in good health, but like also may God bless your child who eats the tomatoes, and may God, bless all of your ancestors, and may you live forever in peace and harmony and have strong employment. And I mean, it's not unusual to get 10 blessings after buying tomatoes in the marketplace, and it continues. This follows you throughout the day, and people all. Mali is predominantly Muslim, but there is a sizable Christian population and animist population, and there's some overlap between these different groups too. Everybody blesses each other in the same language. And so we also were blessed and blessed our neighbors and our, chosen family there. And there's certain, there's a certain spiritual connectivity that you can have with people, regardless of what specific teachings you're studying or book you have, or what time of the week is your holy day. But when everybody is blessing each other continuously and everybody is praying some number of times a day, if it's not 3, then it's 5. And I think that in some ways it's easier to be a religious person in a society like that than in Berkeley. We have this wonderful religious community in Berkeley too, but it's different. I don't get those blessings at, you know, the Berkeley Bowl when I buy tomatoes. So yeah, I mean, we've shared, you know, lots of festivities and holidays. We've celebrated all of the holidays, all the festivals in Mali with our family there, and shared that, and that's been meaningful. And
I remember hanging up the lettuce for the moror on the line like laundry with clothespins, and Ari with this big ceramic pot with this huge anvil crushing making roses for the Seder, and how the kids devoured the matzah. That's what I remember when you were there for Pesach.
Matzah was a big hit. It's true.
And we've also gotten to celebrate Eid with our family there, and, you know, all of the Muslim holidays.
I was wondering about whether that, in fact, living in that society as you have over over a decade, various periods of time, several months at a time, maybe, and a year and a half for you, Jessica, when you were, and Ari, when that year you were a Fulbright scholar, whether it actually deepened your religious commitment or your religious faith or your understanding of the relevance of religion in your lives and in society.
Yeah, I'll say that Muso is not a religious organization, right? It's a US 501c3, also an NGO registered in Mali and Cote d'Ivoire. And it's also that Muso's founders were each inspired by our particular faith practices, by our particular religious practices. We have Muslim and Christian and Jewish co-founders of Muso, right? So we're all on this journey together, and we're just getting started. We've got so much more to do, and there's such immense possibility for healing that we can create together.
That's a very good segue into my next question, which is, how involved in your work has been the American Jewish community?
Well, we've got a number of members of the American Jewish community right on this webinar right now who've been involved from day one. I know that. Looking at the amazing list of participants here. So some members of the American Jewish community that have been involved from the beginning are here right now. And I think this message, understanding that contributing to healthcare for all and doing life-saving work when we have the power to do so. Understanding that is core to halakhic and Jewish practice, our identity as Jews has fueled many people to contribute. We would love to see that continue to grow, and to have this be a core way that all of us as Jews practice together, bind ourselves together in Jewish community through service, through the fulfillment of the mitzvah of pikuach nefesh. I see a lot of great questions coming in through the Q&A box. Should we turn to those, or what do you think?
Fine. You more or less answered my last question, which is how involved in your work. Not only that, but what do you think the American Jewish community can learn from your work? And I think you really already touched on that. Is there anything else you'd like to say before handling the questions?
Just to say that we are excited about the journey to come and to share that journey with our Jewish community, to be on that journey with all of you. And we'd love for everyone on this call to get involved.
Thank you very much. I'm going to add to that the question of what can individuals do? Is there anything those who live here in the United States can do to help Muso and the cause of healthcare around the world?
I think talking about our connection to the entire world and our responsibility to each other and to the entire world, and why that is fundamentally Jewish. Teaching that to our children, talking about that at the Shabbat dinner table. We are responsible not just to our immediate families and our Jewish community and our country, but to all people. And so that's something that I think we have increasingly learned through this journey, and that has both enriched our Jewish practice and helped us to be more effective at this work in the world, trying to bring justice in.
Yeah, and whether any of us can contribute $20, $200, or $2 million, we can provide healing and save lives. So I'll put the link for ways to get involved to the website in the chat for everyone.
Great. Can you quickly, somebody would like to know the origins of the word Muso and why you chose that as the name of your organization. If you could do that quickly, because we have a lot of questions.
Most of our community health workers are women, and most of the caretakers of children in Mali are women. Women are really at the heart of the family. And so that's that was our inroad into building a more functional health system, was for women to be at the core of it.
And Muso means woman.
That's right.
Exactly. So addressing gender inequality as we redesign and rebuild healthcare systems.
But just to be clear, you don't just serve women and children, you serve everybody in the community?
Everybody.
Right.
Great.
Community health workers are specifically trained to do a disproportionate amount of support in the household to women around pregnancy and childbirth preparation, and then to children younger than age 5. But they are screening the whole population for danger signs and doing some diagnostics and treatments in the home for everybody, for example, for malaria. And the health centers we work with treat the whole population. So we're all about universal health care.
Take care of everyone. Yeah.
And how has COVID impacted the communities you work with? And have you been able to provide the vaccines for those in the community?
Yeah, do you want to take this one?
Sure. Muso exists to cure delay in healthcare, because it shouldn't, who gets vaccine, who gets testing, who gets treatment first, who gets care last, shouldn't be based on where we're born or how much money is in our pocket, but it is today. And that's the injustice that we're trying to cure together. And we've seen that it is curable. 2 points of light on that front. The communities that Muso serves and partners with on the edge of Mali's capital have achieved 10x the national vaccination rate in Mali. And have achieved by far the highest rates of vaccination in the country. In addition, we've been partnering with the government and UNICEF and others with an Oxygen for All initiative to ensure that all of Mali's 20 million people, when they go to their nearest hospital, can get care with oxygen when they need it. And one of the most life-saving treatments for oxygen. So we've been building oxygen systems for every district and regional hospital in the country. So there's a lot of work to be done. COVID is extremely time-sensitive illness. The later someone gets care, the more COVID spreads and the more people die. So we need speed to stop COVID. And that's what we're about at Muso.
Mm-hmm. Thank you.
The first week of January, our community health workers are going to start doing training with our government partners to start doing rapid diagnostic tests for COVID in the home as well. So it's going to be a first pilot that may be scaled up more broadly throughout the country.
Someone has an interesting question. They said that Israel does not have diplomatic relations with Mali. And as Jews working there, does that affect you at all?
We've been incredibly welcomed in Mali, both by the Malian government and by communities. It's easier for me to pray 3 times a day in Bamako or elsewhere in Mali than it is in San Francisco. There are 5 calls to prayer, and that means that I can miss 2, and I still can get my 3 in. So it's a very ecumenical society. And so we've been quite welcomed in.
There are some limited relations with Israel through the embassy in Senegal. So I think there have been like a couple moments where we have needed some kind of connection with Israel for some reason, and there's an embassy in Dakar that covers Mali as well.
Mm-hmm. And people are saying, which is so true, how astounding and inspiring your work has been. Do you plan on taking this to other countries? How do you plan to scale it?
Yeah, last year we started working in Côte d'Ivoire with the Ministry of Health there. They asked us to help them with some national healthcare reform around community level care. And earlier this year, we opened a new office there and are preparing to, in addition to the technical assistance work we started for the Minister of Health last year, are on the brink about to launch community health worker training actually in January, and to open our first operational research site with the government of Côte d'Ivoire in February. And then planning to partner with more than 50 community health centers ultimately in several district hospitals to expand this work there. So ultimately we'll be serving probably a similar size number of people in Côte d'Ivoire as in Mali over the next couple of years. And ultimately, our plan is to continue to grow this work beyond Mali and beyond Côte d'Ivoire as well in the coming years, both through our technical assistance supporting other work, through government and other nonprofits in other places, but also through this kind of direct operational research and implementation work that we are now doing in Mali and soon to be doing in Côte d'Ivoire.
Great. Well, and on that note, we do have to wrap up. George, I don't know, as an interviewer or a proud father, if you have any other comments or questions you wanted to ask them.
No, I get a chance to talk to them all offline. I think that'll be fine. But thank you very much, Suzanne.
Yeah, and I'm sorry that we didn't get to more questions, but Ari, Jessica, if there's anything else you want to quickly share before we go with the audience.
It's a real pleasure to be here. Thank you for the opportunity to share a little bit of our story and for the fantastic questions. Thank you, George, for taking the time to facilitate this exchange, and thank you to Suzanne too for hosting us.
Thank you. And I will end with one last question. What advice do you give to others who have dreams of doing something, whether it's in this field of healthcare or something else? What have you learned from your journey doing this that you can share with others?
You can do it. You're more powerful than you think you are. We all are. We have, just as Ari was talking about earlier, immense capacity to do good in the world.
Great. Again, thank you, George. Thank you, Ari. Thank you, Jessica, for sharing with us. We'll see everybody in 2 weeks for our program on Jewish American music, and have a good holiday week for those who are celebrating, and we'll see everybody next time. Thank you.
Thank you.
Thanks,
Bye-bye.
everyone.
Thank you.